All right. Good morning, good afternoon, or good evening, depending on where you're joining us today. Welcome to our podcast on tough questions, smart answers, and all things transport, people, and planet. So today we are being joined by Mr. Chilekwa from the Zambia Road and Safety Trust, to be specific. My name is Carol, and I'm also a young leader in sustainable transport with SLOCAT and VREF. I'm also a PhD researcher at the University of Groningen, and we would like to discuss active travel in Africa, more specifically in the Zambian context. So, Mr. Chilekwa, would you like to introduce yourself and sort of the work that you do at the Zambia Road and Safety Trust?
Thank you, Carol. It's a pleasure to be here. I'm looking forward to this conversation and sharing my perspective. I am Chilekwa, joining you from the Zambia Road Safety Trust. I support program monitoring and evaluation on active mobility and sustainable transport.
All right. Would you like to speak about some of the work that you've done so far with the Zambia Road and Safety Trust, and maybe more specifically on the PATH Partnership for Active Travel and Health?
Yeah, sure. I think we are an government organization that basically focused on road safety and sustainable mobility. And since our inception in 2014, we've been supplementing government efforts on issues of improving road safety and as well as promoting active transport. So over the past years, we have actively engaged, implemented initiatives aimed at improving road safety, such as the Safer Journey to School Children, which is like our insignia program that we've been running since 2020. And we are now running programs that are centered around creating pedestrian-friendly and cyclist-friendly spaces, where we are promoting for the implementation of cyclist-friendly infrastructure as well as pedestrian spaces. So pretty much what we're doing it at this focus of the pedestrians, especially the kids. And very, very recently, we just launched the Streets for Kids program with a specific focus on improving the mobility of the school children and the kids, and creating streets that are safer for the kids. So pretty much that we're doing is anchored around bettering the mobility experience of the vulnerable road users.
Yeah, and I think it's interesting that you mentioned, the project that you're doing more specifically in relation to building infrastructure and pedestrian-oriented infrastructure. And because I think one of the challenges that within the African context that might be a challenge is the absence of, for example, segregated lanes. How do you think walking and cycling can help Zambia implement the Sustainable Development Goals as well, more specifically speaking towards SDG 3, which is also about good health and well-being, and also looking at creating sustainable cities and communities, which relates to SDG 11?
I think, like you mentioned in your preamble, Carol, the experience of Lusaka is not too different from the rest of Africa.
Mm-hmm.
You find that, like in the many developing world cities, here in Lusaka, about 70% of our citizens, they walk and cycle as their daily mode of transport, often out of necessity. So when you speak about the SDG agenda and our walking and cycling has been supplementing on achieving this agenda, I would like to address it by considering two standpoints. The first one is from the public health perspective, and the second one from the transport perspective. We understand from the public health perspective that walking and cycling promote physical activity and exercise. And these two are very, very essential for improving public health and reducing the burden of non-communicable diseases, especially diabetes and cardiovascular diseases. In the transport perspective, we are looking at how best can we better the the experience of the pedestrians and the cyclists to supplement on the effort for improving road safety. As you know, in Africa and Zambia at large, especially here in Lusaka, road traffic accidents are a leading cause of deaths, especially among the young people and the children. So we are looking at how best can we better the health and how best can we contribute to the SDG agenda of halving these tragic accidents. So we are running, like I mentioned, the Safer Journeys to Schools program, where we're improving infrastructure around the school zones and also creating spaces that are pedestrian friendly. We feel by implementing these measures, we can positively contribute to SDG 3, where we're improving good health and well-being, and definitely contributing to SDG target 3.2, where we're contributing to the reduction of the road traffic injuries and fatalities. So not only that, we see that investing in these infrastructures can also contribute tremendously to creating more livable and people-centered communities that prioritize the needs of non-motorized transport users. So these, when you embrace these two, we see that we are directly contributing to SDG 3.6 and SDG 11.2. So positively, this is how we've been able to harness the SDG agenda here in Zambia. We are piloting low-cost initiatives that better the mobility experience of the vulnerable road users through the pilot of these two initiatives that I've just mentioned about.
All right, and you also mentioned, well, making sure from just a pedestrian-oriented perspective, when you think about maybe some of are there any gender disparities that are experienced within active travel? Do you find that as there's a situation where there's more males using non-motorized transport versus women? And how is it also received with children, for example? Is it more of a thing that's very popular in relation to children using NMT?
Of course, I think there are several factors. I would like to, the disparities in terms of walking and cycling. I think there are certain factors that have been very, very instrumental in contributing to this disparity. And in trying to respond to your question, I'd like to take maybe two instances to, number one, we first have to understand the factors that exacerbate this gender gap, the disparity. You find that there are these societal perceptions that cycling is not a suitable or feminine mode of transport for women and girls. So you see that over time, these concerns, they are taught at very, very younger ages, especially in girls. And then these girls grow into women that grow the perception that the cycling environment is not really meant for them. So these factors and also issues concerning personal safety, you know, where there is no properly NMT infrastructure designed in the urban design in many African cities, including Zambia, also disadvantage many ladies from participating into the cycling infrastructure. Not also to forget that there is, limited access to affordable bicycles. Like, I think in Africa and in Zambia in particular, the bicycle is very, very expensive, and just this less accessibility also disadvantage many women from accessing the bicycles and also participating in the cycling. So I think these are some of the factors that are affecting and actually exacerbating this disparity gap.
Okay, and well, you clearly mentioned that maybe the fact that, for example, factors like culture and because I know that this is very much prevalent even in, for example, South Africa, that you don't see a lot of women, for example, using bicycles to cycle, but you get a lot of women who walk to wherever they need to be, and also with similar with men as well. And also because of the fact that, like you mentioned so clearly, that there's an association with sort of not like using cycling is not really like a thing that happens quite a lot with women, for example. So I guess also just talking about gender disparities, I also wanted to maybe highlight people who might have mobility challenges, and how is the approach in Zambia in relation to making sure that also within that spectrum of providing mobility for people with maybe disabilities, how do you then include people with mobility challenges within the same context?
Yeah, one of the ways I think, because in the early stages, I established that there's insufficient integration of gender responsive policies and strategies in transport planning and decision making, which entails that we do not have a group of these people at the transport decision making table, so their voices are not heard, they're not integrated in transport planning. I think one of the things that we really have to look at to bridge this gap is to bring these people at the transport decision-making table so that we have their voices heard, okay? For example, if we were to invest in dedicated cycling infrastructure, dedicated and integrated urban design that also creates spaces for the mobility needs of persons with disability, we are empowering them to have a voice and a say at the transport decision-making table. So I think going forward, this is the wave and this is the vibration and this is the step that we have to take, where we integrate their voices in transport planning.
Yeah, I think it's also very important when you think about inclusivity and equity within transport planning as well, that all groups of people get involved and get considered you've clearly highlighted that, and thank you so much for that. So what do you think the future of cycling in Zambia is, in Zambian cities at large is, or in the African context?
That's a very, very good question. And to be precise, I think the future of cycling is positive, but I think in Africa and Zambia at large, this can take, can hold about both opportunities and challenges, which will require concerted effort to address. Maybe let me try by talking a bit about the opportunities of cycling in Africa at large and Zambia in particular. In the early preamble, we've established that cultural perceptions and stereotypes are associated with how we interpret cycling and walking in Africa. But there is a shift in this because many African cities, as you are aware, they are undergoing through increased urbanization, and there is more exposure to global trends, which actually presents an opportunity to shift the mindset of so many Africans. For example, within Africa, there are so many countries that serve as an inspirational models to how the cycling future of Africa is going to look like. We have seen many African cities, they've run through successive walking and cycling programs, from Lagos to Lusaka, from Lusaka to Addis, from Addis to Kigali, through the promotion of low-cost effective programs like the Car-Free Days, where these programs, they're educating us on the importance of walking and cycling and why we should value them as the as the normal and most viable and empowering modes of transport. We see many cities investing, in walking infrastructure where there's more design coming on board, where there is now dedicated design for sidewalks, where cities are designing sidewalks where people can just walk independently. Many other cities are coming on board to form policies around walking and cycling. I think these are some of the opportunities. And thirdly, I think there is this trend of positioning cycling as a sustainable and health promoting mode of transport, which I feel can resonate with policymakers and the local communities at large. Now, among the challenges is what you actually established in your early statement, Carol. I think many African cities, they lack dedicated and well-designed cycling infrastructure, which pose the safety risk on the cyclist. Not only that, transportation planning and also decision-making processes in African cities often prioritize, private vehicle use over sustainable modes like cycling. I think changing these, integrating these, can shape a more promising future for cycling, both in Zambia as a country and the African cities. And we need a more robust and radical approach that should, number one, prioritize and invest in high quality and integrated cycling infrastructure that promotes safety and connectivity. In my country, for example, I'd like to raise an example of, the sidewalks. You find that there are sidewalks in certain spaces, but these sidewalks, they are not continuous. So you would start from one point, you're walking along a sidewalk, but you find that it ends at another point. But here we are saying, for us to create a more promising future, the radical approach that we need should integrate continuous sidewalks that are very, very connective from one point to another and from that point to another point. To achieve this, it calls to strengthen institutional capacity and cross-sectoral collaboration to mainstream cycling in urban planning and policy making. I think it is such initiatives, it is such holistic programs that address the cultural and economic and gender-related barriers to cycling. So ideally, we are at the edge where many cities are realizing that cycling and walking are key in meeting the SDGs agenda and also in meeting the climate agenda. So the future is positive. The future is very, very promising to achieving this as a continent.
Right. This was very interesting perspective from you, Chilekwa. And yeah, I also think that it was nice to hear from a different perspective, being that I'm South African myself. So thank you so much for joining us today and for having time to allow us to have this discussion with you, and yeah, and for providing these amazing insights for our podcast.
Thank you, Carol. It's always a pleasure, and really looking forward to the next series. Hopefully I'll be invited again.
Yes, thank you so much. So we have come to the end of our today's episode. And for our viewers and followers and listeners, please stay tuned for more upcoming podcast episodes with Slow Cat. So thank you so much.
Thank you. Bye-bye.